we work in a whole lot of research projects, different ones, big ones, small ones, a big one, a national one that's going on now, where stroke survivors actually are co-researchers, is about this subject. Why in the Netherlands as well as in the rest of the world, why are people that have suffered a stroke not involved all the time in every decision that a healthcare system makes? How is that, and what do we need to do to make that possible? What do stroke survivors need to do or learn, and more than that, what do professionals need to learn or do differently to be able to involve them? I know a whole lot of patient associations and I look at their boards and I don't even see a patient in that. Why? I just strongly believe that. Don't talk about people or work. Try to think somewhere at your desk of, oh, that would be so nice for stroke survivors. You don't know, go ask them, they know. And I just can't understand that there's still people in this world that do not think that way. But to get them involved in that scientific research, because it's all universities and academic hospitals working in that project, took some time. But I started out being the patient partner when we were still applying for the grant. And I've just told my story over and over and over again. And as you know, I can be pretty convincing. And if I believe that something should go in a certain way, I'll try to get it done. And I guess I convinced them. And for that first project, we decided we needed 6 co-researchers. So we had an advertisement and they could apply. And within 2 days, we had over 90 reactions of all stroke survivors, most of them highly educated. We actually had a hard time picking out just 6, because we had way more that would have been able to do the job. And that's how we came to the idea that as an association, we should make a database of all stroke survivors and their talents, because now that we're using stroke survivors, we get more and more questions for scientific research and for all kinds of things. If we know maybe that one stroke survivor that will be able, yeah, we do. We got a database. What are you looking for?
So, talking about another level of patient, of user involvement, we have this project, the Charité, this very big hospital with a lot of academic and scientific research going on there about stroke. And 10 years ago, it was a European project. And within the European project, we talked about quality indicators, and also we talked about the concept of user involvement in Europe. So we involved SAFE, and we also had a project in Germany about user involvement. And so we did some literature research, the King's College was involved, and so we recognized that there was no user involvement in research when it comes to stroke in Germany, very similar to other regions in all over Europe. So what we did is we did some site visiting in London, in the South London Register, and they had a user group. So we learned how to build up a user group, what the topics of a user group were, and how the user group, the patient group, the stroke survivor group, supported research. And we implemented a similar project at the Charité in Berlin. And the funny thing was we didn't know how to involve patients from the beginning. So we started at the stroke unit, but we recognized that this was too early for the stroke patient, because directly after a stroke, trying to convince people that they should work in a user group, trying to convey the concept, what can be done to support research, it was too early. We had another approach. We went to the rehabilitation centers within Berlin and asked people there. And then we had to convince people because maybe it's a German attitude of many patients. Well, working together with researchers, we don't know about research, and it was a little bit overwhelming. But finally, we were able to manage to build up a user group consisting of 8 to 10 stroke survivors who were interested in working together with researchers. And now it seems to work because researchers are coming to this user group. If they have an idea about research, they are talking about the outcomes, and they tell people about their research idea, and I think there is now a lot of discussion going on. And I've been to some of these sessions, and I've seen that the way how researchers and stroke survivors communicate with each other is not from the beginning so quite clear how to do it. So the first time researchers gave a lecture, but after a while it changed, and people said, no, don't want to be lectured. We have ideas about outcomes on our own, or we have ideas for future project, and this seems to work out quite nicely.